Good morning to everyone, to all those who make this broadcast possible, to Lazaro supporting us with his commentaries and information, and good morning to everyone tuned in to this briefing. We start today's briefing with the unfortunate news of the death of one person yesterday. The patient was relatively young, a 54-year-old male from the province of Ciego de Ávila. He had some pre-existing health conditions which may have contributed to his response to the virus, which was very quick. From the moment his symptoms appeared, then being admitted to hospital and treated in intensive care, his clinical evolution meant that little could be done, although the patient began to receive treatment as soon as he was admitted to hospital, in accordance with our treatment protocols. Unfortunately, the patient died as a result of having contracted COVID-19. We offer our condolences to the family and friends of the deceased for their deeply felt loss. As I always mention, patients often respond well to treatment, some never developing symptoms of the virus. However, the evolution of the virus in other patients can have fatal consequences. Once again, I offer our condolences to the friends and family of the deceased. Today, 1,469 people are hospitalized in Cuba. 60 are under observation. There are 803 suspected cases and 606 confirmed active cases. Still quite a high number. Yesterday, we finally managed to process over 7,000 samples, 7,164, in our various molecular biology laboratories. You will recall that we have been creating the conditions over these last weeks to be able to process over 7,000 samples. 2,076 of the samples were processed at the Pedro Curie Tropical Medicine Institute, 950 in Havana's Hygiene, Epidemiology and Microbiology Center, 837 in Villa Caras, 279 in Santiago de Cubas, 765 in the Genetic Engineering and Biotechnology Center Lab, 304 in the Civil Defense Laboratories, 468 in the Naval Hospital, 448 in the Hermanos Almahedas Hospital Laboratory, 427 in the Manuel Fajardo Hospital, 374 in the Molecular Immunology Center, and 246 in the Fructuoso Rodriguez Hospital. As such, we were able to process 7,164 samples yesterday. Of the samples processed, 43 tested positive for COVID-19. That's 43 people diagnosed with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 439,204, of which 4,352 people, or 0.99% of all cases, have tested positive for the virus. As I always mention, samples from all of the country's provinces and the Isle of Youth Special Municipality were tested. 137 from Pinar del Rio, 473 from Artemisa, the most 5,268 from Havana, 152 from Mayabeque, 213 from Villa Clara, 220 from Ciego de Ávila, 552 from Cienfuegos, which continues to screen residents for the virus, and so on and so forth from all of the country's provinces. Of the 43 positive cases diagnosed yesterday, 42 are Cubans, and one is a foreigner who arrived in our country but had previously contracted the virus abroad, representing one imported case. 32, or 74.4% of the 43 positive cases diagnosed yesterday are confirmed case contacts. This means that 89.3% of all diagnosed cases in Cuba had contact with someone who had previously tested positive for the virus. Many such patients are already in hospital when they are tested for the virus, because, as you know, as soon as someone is diagnosed with COVID-19, all their contacts are immediately isolated and tested. Of the 43 cases diagnosed yesterday, the source of infection linked to 10 is yet to be determined. This means that the source of infection in 37 cases reported over the last 15 days is still being investigated. Yesterday, one person to have tested positive for the virus contracted it abroad, for a total of 416 imported cases. Of the 43 diagnosed cases yesterday, 27 are male for 50.1% of all cases, while 16 are female, representing 49.9% of all diagnosed cases. 22, or 51.5% of the 43 cases yesterday were asymptomatic at the time of testing. This represents 58.5% of all positive cases on the island since the pandemic began, and 67.7% of cases diagnosed in the last 15 days. Let me reiterate that people with no symptoms of the virus pose a high risk of spreading the disease. Some studies even claim that asymptomatic patients transmit more of the virus than those with symptoms. Given the high risk posed by asymptomatic cases, we must all fully comply with the established restriction, protection, and hygiene measures. By age group, 10 or 23.2% of positive cases diagnosed yesterday are under the age of 20, 9 of which are under the age of 18, for a total of 467 children or pediatric cases to have tested positive for the virus in Cuba. 389, or 83.3% of which have responded well to treatment and been discharged from hospital. Meanwhile, 15 people diagnosed with the virus yesterday are between 20 and 39 years of age, 11 cases are between 40 and 59, and 7 are over the age of 60. Of the 43 cases diagnosed yesterday, 17 belong to Havana, 16 to Ciego de Ávila, 6 to Artemisa, and 4 to Pinar del Rio. Among the 17 from Havana is the one imported case. The 42 autochthonous cases belong to Pinar del Rio, with 4 from the municipality of the same name, 6 to Artemisa, and the municipalities of San Cristobal with 3, Mariel with 1, Alcicar with 1, and Candelaria also with one case. 16 cases belong to Ciego de Ávila and the municipality of the same name. The 17 cases from Havana belong to the municipalities of Arroyo Naranjo with 6, Boyeros with 3, 10 de Octubre with 3, Habana del Este, Guanabacoa, Cotorro and Cerro, all with 1 each. The imported case is also from Havana and the municipality of Playa, and therefore is not the result of local transmission. Yesterday's results, therefore, mean that Havana continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 20.09, lower than yesterday's figure. Artemisa follows with a rate of 14.18, higher than yesterday. Ciego de Ávila's rate rises to 11.44. Matanzas drops to 5.56. Pinar del Rio rises to 1.88 per 100,000 inhabitants. Las Tunas has a rate of 0.93. Villa Clara with 0.51. Mayabeque with 0.26. And Camagüey with a rate of 0.13 per 100,000 inhabitants. This means that Cuba's rate dropped slightly in comparison to yesterday's, now standing at 5.48 per 100,000 inhabitants over the last 15 days. To summarize, of the 4,352 people who have been diagnosed with the virus thus far in Cuba, 606, or 13.9%, are active hospitalized cases. 594, or 98%, are clinically stable. Yesterday, 1 COVID-19 related death occurred in the country. This means that the COVID-19 death toll on the island stands at 102, with a mortality rate of 2.34%, lower than the global rate of 3.28% and regional rate, which stands at 3.46%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 52 people were discharged from hospital, a positive result in regards to the discharge to confirmed case rate ratio. 28 people were discharged from Havana, 8 from Matanzas, 4 in Santiago de Cuba, 4 in Guantánamo, 2 each in Granma and Villa Clara, and 1 each in Mayabeque, Camagüey, Las Tunas, and Artemisa. This means that, to date, 3,642 people, or 83.7% of all confirmed cases in Cuba, have recovered from the virus. Today, 2 patients continue to be in a critical state, and 10 reported as serious. Yesterday, 2 patients joined the group of those reported as serious, and 5 serious patients passed to closely monitored, meaning that today there are 2 critical and 10 serious patients being treated in our hospitals. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 280,864 people were diagnosed with the virus, for a total of 26,921,111 confirmed cases since the start of the pandemic. Yesterday, 6,876 people died of the virus, for a total of 881,831 COVID-19 fatalities and a mortality rate of 3.28%. The region of the Americas, which accounts for 52.56% of all cases worldwide, reported 119,049 new cases yesterday, for a total of 14,150,397 people to have been diagnosed with the virus. Of these 6,878 people who died of the virus yesterday, 4,597 were from the region of the Americas, for a death toll of 489,270 and a mortality rate of 3.46%. The United States continues to top the list of countries worst affected by the pandemic, with 6,245,866 confirmed cases. Brazil follows with 4,123,000 cases, then India with 4,113,811 confirmed cases. Although Telesur reported this morning that India now occupies second place on the list, above Brazil. However, the information I am reporting today is the information that we had as of yesterday. From the region, among the worst affected countries worldwide are Peru, Colombia, and Mexico, with high numbers of COVID-19 fatalities, 2,206 reported in a single day. Then Argentina and Chile, all countries from the Americas. This is the information that we have on the behavior of the pandemic in Cuba and the world.